Africa. And that's exactly what we've done. Most recently, by deploying United States military members to Liberia and to the region to support civilian efforts on the ground. Today, we are using a whole-of-government approach and response to control this epidemic at its source. And that's evidenced by the people who are here with me today at the podium. We're doing a number of things to address this epidemic at its source in West Africa, first and foremost. We are also enhancing our domestic preparedness and ability to respond to isolated cases here in the United States. And as importantly, we are rallying the international community to contribute to this response, and that was seen most recently when the President spoke at the United Nations last week, and when we had an unprecedented vote in the UN Security Council to contribute and to show galvanizing forces of the international community to contribute to this response. The strategy the United States is executing has 4 key goals: to control the epidemic at its source in West Africa, to mitigate the second-order impacts of this epidemic, to lead a coordinated international response, and to build a robust global health security infrastructure so we are prepared over the long run to confront epidemics such as the one we're facing today. I think it's very important to remind the American people that the United States has the most capable healthcare infrastructure and the best doctors in the world, bar none. And it's why people travel from all over the world to receive medical care here in the United States. Finally, I want to emphasize that the United States is prepared to deal with this crisis, both at home and in the region. Every Ebola outbreak over the past 40 years has been stopped. We know how to do this, and we will do it again. With America's leadership, I'm confident, and President Obama is confident, that this epidemic will also be stopped. So with that, let me turn the podium over to Secretary Burwell.
Thank you, Lisa. Since the outbreak began, the United States government has been engaged in preparation both at home and abroad to protect our homeland and stop the epidemic at its source. We've been working for many months to ensure that the United States is protected. CDC sent out our first guidance to state and local officials on July 28th, and it's been followed with 6 additional sets of guidance, and the latest was just issued yesterday. In addition, we have enhanced our surveillance and laboratory testing capacity in states to make sure that they're able to detect cases. Been in regular and repeated contact with state officials and health departments, including developing guidance and tools for departments to conduct public health investigations. We're continuing to provide guidance for flight crews, emergency medical service units at airports, and Customs and Border Patrol officers about reporting ill travelers to the CDC. And we're continuing to work with hospitals and healthcare workers around the country to prepare most effectively, both in terms of detecting symptoms and then responding appropriately. As we saw just a few months ago, almost 2 months ago, in Carolinas Medical Center in Charlotte, North Carolina, and at Mount Sinai in New York, hospitals and healthcare systems reacted and took appropriate steps. Fortunately, in those cases, the cases were not positive. We saw Emory's ability to handle the first cases that returned from West Africa, followed by the Nebraska Medical Center's ability to do the same. In Dallas, the public health system is now handling the case with the protocols that we know control this disease. We recognize the concern that even a single case of Ebola creates on our shores. But we have the public health systems and the public health providers in place to contain the spread of this disease. We've taken a number of precautions to prevent the spread. We've instituted exit screening procedures in West Africa to prevent those who have been exposed to Ebola or are sick with Ebola from traveling. The Department of Homeland Security is in the process of advising all travelers returning to the U.S. from countries with Ebola outbreaks in West Africa to monitor their health for 21 days and to immediately seek medical help if any symptoms do develop. The Centers for Disease Control stands ready, as it has in Dallas, to deploy expert teams when needed. Finally, our scientists at the Food and Drug Administration and the National Institutes of Health are working tirelessly to develop new vaccines and treatments for Ebola. We remain focused on working with our partners on the ground to stop the epidemic at its source, and we're continuing to take the necessary precautions across the United States government to prevent the epidemic from spreading further. And I'd like to now turn to Dr. Tony Fauci, who is the director of the National Institute of Allergy and Infectious Diseases at the NIH, to talk a little bit about epidemiology.
Thank you very much, Secretary Burwell. I'd like to provide some basic but important facts about Ebola and its transmission. Although Ebola is an extremely serious viral disease with a high fatality rate, it is not easily transmitted. Specifically, the Ebola virus is not easily spread like a cold or influenza. You must come into direct contact with the bodily fluids of a sick person or through exposure to objects that have been contaminated with infected bodily fluids. Ebola is not a respiratory disease like the flu, and so it is not transmitted through the air. This is important. Individuals who are not symptomatic are not contagious. In order for the virus to be transmitted, an individual would have to have direct contact with an individual who is experiencing symptoms or who has died of the disease. We have considerable experience in dealing with Ebola, both in controlling and in preventing outbreaks. This is based on experience with almost 24 outbreaks in Central Africa since the virus was first isolated in 1976. The key elements to that control and the prevention of outbreaks when Ebola rises in a community is to first identify cases, isolate them, care for them under conditions that protect the healthcare workers, and importantly, perform contact tracing. People in direct contact with a sick Ebola patient should be monitored for symptoms for at least 21 days. If no symptoms arise, the individual is cleared. If symptoms arise, the person is appropriately isolated and cared for. This formula has worked very well over many years. The situation in West Africa has been very difficult, largely due to the lack of an adequate healthcare infrastructure to deal with the outbreak. And so I want to reiterate what the Secretary said. Our healthcare infrastructure in the United States is well equipped to stop Ebola in its tracks. As the Secretary said, in addition to managing the issues associated with containing the situation in Dallas as it exists today and addressing the very dire situation as it exists in Africa today, we are working very aggressively and energetically to develop and test a vaccine to prevent Ebola and therapeutics to treat it. And now I'd like to introduce Dr. Raj Shah, the administrator of USAID.
Thank you, Dr. Fauci. I'd like to take a moment to describe the effort in West Africa, which, as has been noted, includes a major effort to control the disease, includes specific actions to deal with the secondary impacts of the crisis in several West African countries, including making food, water, and government support more available, and the effort to build out an international coalition, as Lisa previously discussed. Our response in West Africa started in the spring and accelerated dramatically over the summer. This coordinated civilian response included the largest ever disaster assistance response team from USAID, the largest ever more than 100-person Centers for Disease Control capability deployed to Liberia, Sierra Leone, Guinea, and countries throughout the region, and efforts partnering with our Department of Defense colleagues to more than double the laboratory and diagnostic capacity in West Africa to ensure that cases could be identified and positively confirmed. Since that time, we've helped deliver more than 120,000 sets of personal protective equipment, build out Ebola treatment units, provide technical assistance for airport screening throughout the region, and increase the basic capacity of what has been a weak existing healthcare infrastructure to deal with this disease. As the President noted in his comments at the Centers for Disease Control a few weeks ago, our strategy now is clear. First, we're investing in a strong incident command system at the national and local level throughout the region to identify cases and trace contacts. Second, we're building out Ebola treatment units so that enough bed capacity exists for as many positively identified patients as possible to receive isolation and treatment. We're on path to put in place the WHO plan of more than 2,800 beds in Liberia, according to their timeline, and just in the last 10 days have seen significant new Ebola treatment capability come online, including the largest Ebola treatment unit in Liberia, the new Island Clinic, which we helped build and staff. Third, we're engaging in an extensive community care strategy that includes 10 to 20 bed community care center units that are placed throughout rural communities in particular to help isolate patients in those communities and support the distribution of hygiene and protective equipment kits so families can protect their patients and their families. We've distributed more than 9,000 of those kits together with UNICEF and the World Health Organization and are on path to have about 10,000 arrive in country and be distributed through Liberia on a weekly basis. In recent days, we've been successful in scaling up the effort to identify, reach, and in a safe and dignified manner deal with bodies of patients who are deceased from Ebola. We now have more than 50 safe burial teams with full protective equipment and careful protocols in place, and we're noting that more than 3/4 of all bodies in Liberia of positively identified patients are now being cleared safely within the 24-hour period. This is critically important because that is an important existing mode of transmission. I'd further note that the scale-up of Centers for Disease Control and USAID efforts through June and August was quite significant, but the complexity of building out Ebola treatment units and providing the logistics support in terms of protective equipment and medicines required the significant additional resources brought by the Department of Defense and announced by President Obama. So I'm pleased to introduce General David Rodriguez, the commander of Africa Command, to describe those specific efforts. Thank you.
Thanks, Administrator. As we deploy America's sons and daughters to support the comprehensive United States government effort led by the United States Agency for International Development, we'll do everything in our power to address and mitigate any potential risk to our service members, civilian employees, and their families. As Director Shaw or Administrator Shaw mentioned, the areas that we're focusing on are command and control, and that is to help support and coordinate the efforts of both USAID and the international community. We are also working on training the people who man and manage the Ebola treatment units. We're supporting the engineering efforts to build out the Ebola treatment units, and we're also doing an effort in the area of logistics, which this is a tremendous logistics effort, as the Administrator pointed out. For our soldiers prior to deployment, we'll provide them the best equipment and training that we can. We're assessing risk based on the service member's mission, their location, and their activities in execution of their operations. We're implementing procedures to reduce or eliminate the risk of transmission as service members go about their daily missions, including the use of personal protective equipment, hygiene protocols, and monitoring. Prior to redeploying service members back home, we will screen and identify anyone who faced an elevated risk of exposure, and we take all necessary steps to minimize any potential transmission in accordance with the international standards that our medical professionals have given us. In the end, our equipment, training, procedures, and most of all, the discipline of our leaders and our force will help us to ensure that our team accomplishes its mission without posing a risk to our nation and our fellow citizens.